Good morning, everyone. Buenos dias,早安, Joyunachim, guten Morgen. I'm honored to be here today to represent spine patients through the Arthroplasty Patient Foundation. Thanks for inviting me. Today I'll present my perspective as a spine patient and how I leveraged my experiences to help others through ADR support and the nonprofit. I'll share my observations regarding the daunting challenges that spine patients face every day. You'll hear how the organization is tackling these challenges. And you may see how these solutions could be valuable to both patients and doctors. So what brought me here today? My journey started with chronic spine pain in the 90s and led to disability in 2003. My dogged pursuit of the right medical option led me through a maze of options, and I chose disc replacement with the Charité in 2004. By the way, I did win my insurance appeal against Blue Cross later in 2004. But physically, psychologically, and financially, this long process just seemed too big of a burden for any patient to endure, so I set out to help patients avoid these obstacles in any way that I could. There's no question that pain and disability was a life-changing event for me. As these insightful quotes suggest, my recovery inspired me and strengthened my resolve to make a difference in the spine patient community. So after ADR in Boston in 2004, which gave me 100% pain relief, I employed my strong back, clear vision, and strengthened soul to start the next chapter in my life. In 2004, we launched the ADR support community to encourage intelligent discussion on new spine treatments like ADR. The community facilitates on and offline discussion, provides current information on motion preservation technologies, and keeps non-patients away. New spine treatments are often confusing to the layman, and recently approved medical procedures are rarely covered by insurance. Since patients wanted help with these problems and still require objective intelligence from a neutral source, these needs compelled me to start a nonprofit organization. Since 2006, the APF has attracted a global and diverse team of medical professionals to help shape the organization's mission. Each of our board members offers a unique value to the nonprofit in general, and particularly to the patient community that it serves. Since spine patients have complex needs, our board will evolve to serve those patients' needs. Our mission focuses on helping spine patients consider the best solution for their spinal dysfunction, whether it be ADR, biologic, or alternative treatments. Though most of the ADR support community focuses on ADR, we strive to track and report on developing technologies that preserve healthy motion in the spine. So how do we reach patients from all over the world? ADR support became a truly global community early on. This 2006 snapshot shows visitors from 48 countries. This community is transitional. People register, interact, and learn from other patients and often make decisions about their healthcare options. More than 435 members have had ADR surgery and posted their progress with others. However, some appear to have other health problems both before and after their surgery, and I'll discuss these comorbidities when I present our new survey data. Our members help other patients needing information on things like insurance appeals, to pre-op diagnostics, to device design. While patients are suffering with pain, they need so much more support. The nonprofit and ADR support help with some of this, but it's really not enough. That's one reason why we produced a 75-minute film to help patients navigate their way back to wellness. So let me ask you a question. Have any of you been a spine patient or really tried to put yourself in your patient's shoes? It's a brutal world. In 2005, I reflected upon my journey to figure out the best way to tell the story of resolving back pain with motion preservation technologies. Working with a talented video producer, we crafted a storyline, created interviews for patients, and set out to produce an educational film for people who are considering spine surgery. So here's one way of circumscribing a spine patient's hellish journey. We created this taxonomy to define the chapters in the 75-minute film called Getting Back on Their Feet. Released in 2009, this comprehensive film has already helped people in more than 7 countries. Patients and doctors report that it leads to more productive and efficient preoperative discussions. Yet, it's also received high marks from authors like Dr. Nick DeNubli in his new book, Framework for the Lower Back. I'm also happy to share that the film has received good marks from lawyers from both sides of the fence. We know the film doesn't constitute a support system per se, but it may help patients build one. It may motivate them to be their own advocate, researcher, and Sherpa. And we all know that patients' needs are numerous. They're complicated. They're physiological. They're personal. They're financial. And even sometimes they're spiritual. So let's focus on the challenges we can address as a tightly knit community, working together, with the patient being our number one customer. Let's look at the top worries of patients today. By the way, I presented this slide 2 years ago in Miami, and patients still have the same concerns ranging from facet arthrosis, other contraindications, ADR design variations, osteoporosis screening, insurance reimbursement, failures, revisions, disease etiology, medical tourism. There are other vexing issues in the spine patient's world, but these ones here are omnipresent. So how do we tackle these problems? Since 2003, I've toiled over the best survey methods to collect credible and useful intelligence from the patient community that would serve both patients and doctors. Today, we're happy to share some results from our recent online survey. We spent considerable time obtaining consent, preserving anonymity, authenticating users, and of course, securing the data. To ensure our success, we partner with Quality Metrics, the preeminent survey analyst firm, creator and owner of the SF-36. I'd like to present some data from the first part of the survey involving insurance, surgery locations, obstacles to decision-making, comorbidities, complications, and pre-op diagnostics. For the record, this new survey is copyright protected. So here's some profile data on the 101 patients who completed the survey in early March. 50-50 were split on gender, 91% were Caucasian, the average age was 45. Percentage of spine surgeries, 67% lumbar, 39% cervical, 4% sacral. 61% had ADR covered by insurance, which surprised me a little bit. Total average cost for ADR for one or more levels, $45,510. Total average out-of-pocket costs for one or more levels, $19,030. 64% had comorbidities of some kind, things like diabetes, lupus, chronic fatigue, etc. Insurance, I was a bit surprised to see such a wide range of insurance providers, but no surprise that Blue Cross, Aetna, and United comprised 39% of the total. Location of patient surgery, it didn't surprise me that over a quarter of the patients flew to Deutschland for surgery, since ADR has been there for decades. But the attendant observation concerns the outsourcing trend and to witness how other countries are attracting patients from the US. Medical tourism does present risks to patients. Sales tactics from tourism brokers often outcompete US practices based largely on pricing. And some international patients with post-op complications sometimes might not get the right follow-up care. But back to the positive here, we now have a globally active online community and a perpetual and reliable survey instrument, and we are collecting constructive feedback that helps all of us better understand and measure the patient perspective. I mentioned obstacles patients face earlier, and we see some of them quantified here. Surgical costs still concern patients, and as we know, they have to battle for insurance coverage or pay out of pocket. How many of you doctors here have struggled to provide price quotes to your patients? But don't you worry, help is on the way. Uncle Sam's coming to help you. You may have heard about the Transparency in All Healthcare Act, Pricing Act of 2010. What a name. If passed, the bill will force American surgical practices to provide concrete pricing to the public sooner than later. Though this may be painful to implement, this could be a small victory for spine patients. This data really makes me sad. It shows in part why there may be an increasing need for multi-level disc surgery and why some patients have been going overseas for multi-level surgery. This data reflects the number of DDD levels affecting a patient, treated or untreated. But there's other data not shown here, and that is how patients with DDD are increasingly younger and younger, and that's really, really a shame. Complications. At first, this result surprised me, but the results appear to be comparatively better than previous studies, but I'll defer, of course, to the doctors here about that assessment. That said, I'd like to address one of these issues. Out of all the stories that can be told from the survey data, this set troubles me the most, but it can also provide an opportunity for constructive change. If DEXA scans are one of the most effective and low-cost ways to assess localized osteoporosis of the spine, why didn't only 6 people have them preoperatively? Should DEXA scans be a pre-op requirement? But to focus on the positive here, this highlights why we have implemented the survey to identify issues and work towards a corrective remedy. In summary, I think we can all agree that spine patients need access to not only the best doctors and the best spinal treatments, but also a really solid support system. Looking ahead, we will continue to create services designed to help both patients and doctors improve the quality of care. Thank you all very, very much for your time today. Peace and good health to all of you.